Okay, so what we have here is a 3D CT scan of your hip.
Yes.
Okay. So kind of explain to me what's going on here. This is your left hip?
Yep.
Left hip. And that's good, everything's good there. Doctor says everything's good there.
Yes.
Okay. But the pelvis is at a funky
Fine.
angle here,
Yes.
causing you back pain.
Yep.
Okay. And what's going on here? What was done here?
They took the ball of my right hip off. So this ball right here.
Yeah, right here?
Yep. And then they left it out of socket. My socket's right here.
Uh-huh.
What they did that for is so I could grow into my body. Get to the size that I needed to be before they did the reconstruction hip surgery. Which,
Right, but more importantly, because the cartilage was gone and it was also causing you pain.
yes.
So what they ended up doing was tightening that tendon so it tuck up here by the other part of the hip,
Yep.
out and away. So it's not even rubbing there anymore.
Yes.
Okay.
Correct. And
So what their plan is, their plan is to put an artificial hip in here,
yes.
right here,
Mm-hmm.
and that will align your pelvis, relieve the back pain, and of course give you some more mobility.
Yes.
Okay. Hi guys, I'm Cody Burr. This is Cody Burr, Utah's youngest surviving cancer patient. So kind of talk to me. What have you been through? What's said? What's done? As I understand, you're the youngest surviving cancer patient in Utah.
Yes.
Yeah. And you've been through how many surgeries so far?
Been through 59 surgeries that have been life-threatening surgeries. I go through the 60th surgery, which is a cosmetic surgery, which will help me have more mobility in my life.
Which is this surgery to replace the hip with the socket, so giving you more mobility.
Yes.
And some of the other surgeries, you've had reconstructive back surgery
Yes.
several times because you've broken the rods in your
Yeah.
back.
Yep.
So the other surgeries was a pancreatic surgery.
Yeah. The other one was removing my gallbladder. The other one was taking out left kidney. All life-threatening surgeries. Just surgeries for, 1 step forward, 2 steps back.
Yeah, and it's kind of always been that way. They fixed your back, and then something happened with it. You had to go in and have it reconstructed, so there was less pain and more mobility involved.
Yeah.
And same thing with the pancreas. It's causing you a lot of pain. You couldn't even get out of bed.
Mm-hmm.
And you were fortunate enough in the past that you have Medicaid or Medicare,
Both
of them, so that the government would help take care of those surgeries and pay for them, so you could have a quality of life and get fixed per se.
Yep.
But this is the first ever life-enabling surgery.
Right.
You can now get the hip replaced and start doing some of the normal things you used to do,
Right.
like going to the gym and getting back on schedule and going motorcycle riding, four-wheeling with me, of course, and the other
Yeah.
friends, right?
Mhm.
So, kind of our goal here is to set up a fundraiser for Cody, so that Cody can have this cosmetic surgery, and that will enable him to do his normal day-to-day activities. Be able to get up and do some things with your day instead of laying in bed all the time with chronic pain.
Right.
So that's kind of Cody's goal here, is to set up a fundraiser so that Cody can get his stuff taken care of, and maybe have a couple extra dollars to help out somebody else who's got to have the same type of scenario.
Yeah.
There are a lot of people that are, like you have all these surgeries, and most of them are government paid for, taken care of,
Yeah, and then they have cosmetic surgeries like this one
that they just don't even cover at all. They don't even touch.
They don't care. And this is the most critical surgery because that's the surgery that will get me out of most pain.
Yeah.
And give me back a lot of my mobility.
Mobility.
Yeah, instead of being, you know, difference in my hip, you know, you can see this one way up and this one way down. That pelvis, and the way it's tilting towards the left side. This left side is always tense, and this right side is always loose.
Right. And just because the way you're situated with the hip being up here so far, as a matter of fact, they cut this off right about here, right?
Yep.
And so your legs are actually different lengths.
Mm-hmm.
One shorter than the other.
Yes.
And that makes it kind of hard for, you know, like trying to load the wheelchair in your vehicle to go places and things like that.
Yeah.
And the physical therapist said that on your legs, your left leg here is actually more mobile than your right leg.
Yes.
Because
The right leg is more mobile than my left leg because of the left side is getting damaged because of how much I use it. I'm using it 100%, and 100% of the weight is going on the left side. And what the doctor wants to try to do is get the right leg going so that it can be 50-50 instead of 100% on one leg. And get it so that I'm more stable and able to relieve one side or the other.
Yeah, so just balance them out so that you can now have a normal life. It's not so strenuous on your body with all of that.
Right.
All right. So when are they doing surgery?
The 10th.
The 10th, on Tuesday?
Yes.
Tuesday. Are they going to be recording that, or?
Hopefully, yeah. The doctor is a doctor that has done YouTube videos before.
All right.
And he said that he might record it. So I'll post to you guys that video if it does show up. And thank you for watching.
Yep, so in the following weeks we'll have a couple more interviews with Cody on, you know, his progression since the surgery, and in the link below you should be able to follow the link on the actual procedure of the surgery and the recording, if they'll give it to us, of Cody's surgery and how it went and some of the complications they had. So like, subscribe, tell your friends, share the video, and help us support us so we can help others. Thank you.